And today also the CDC is announcing additional steps Americans can take to defend against the transmission of the virus. From recent studies, we know that the transmission from individuals without symptoms is playing a more significant role in the spread of the virus than previously understood. So you don't seem to have symptoms and it still gets transferred. In light of these studies, the CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary. You don't have to do it. They suggest it for a period of time, but this is voluntary. I don't think I'm going to be doing it, but you have a lot of ways you can look at it as follows. The CDC is recommending that Americans wear a basic cloth or fabric mask. They can be either purchased online or simply made at home, probably material that you'd have at home. These face coverings can be easily washed or reused. I want to emphasize that the CDC is not recommending the use of medical grade or surgical grade masks, and we want that to be used for our great medical people that are working so hard.
So we've known for some time that the virus can spread from people who are asymptomatic. That means they're not showing symptoms. But it's starting to become clear more recently the extent of the problem of the spread by asymptomatic people. So it appears that people who are asymptomatic, right, might be asymptomatic for a longer period of time, so that they might be walking around for 2 or 3 days having no idea that they're infected at all. They don't even know they're sick. They don't feel sick. They feel perfectly healthy like the rest of us, but they're walking around and they're spreading that virus. And new evidence has come out that it might be just enough to talk or breathe near someone in order to infect them, meaning a lot of these infections are taking place among a group of people who every person in that group thinks they're perfectly healthy, right? So to limit that, what's going on is they are now suggesting that we be wearing things over our face when we go out. So they're saying not health masks. They haven't said specifically, but I think the idea is that the doctors and nurses need those specific medical masks, whereas the rest of us, it's being said, can get away with things like scarves or homemade masks where you have some kind of cloth. And the idea here is that if I'm sick but I'm wearing a mask and I have to cough or I breathe or I sneeze or something, I'm less likely to shoot all those viruses out at you because I have a covering over my face. And the same thing for you. Even if you don't think you're sick, when you have that over your face and you're breathing and just normal things that we do when we're out and about, you're not spreading that virus as much because the virus only gets to the edge of your face rather than shooting it 15 feet across a room, right? All the medical research shows it's surprising when you cough how far some of those droplets can get, and that's obviously a bad thing. So they're coming out now and saying we should be wearing masks when we go out in public. I was doing that anyways when I went out for groceries the other day. I wore stuff over my face, right? Some kind of covering. It just makes me feel a little bit better. I'm not infecting other people. And also, I just don't really trust someone else, right? If I'm near someone else and they cough and they're not able to cover their mouth in time, I don't really want them coughing directly at my face and into my mouth. That's disgusting. Whereas at least if I have something over my face and someone else accidentally coughs, then hopefully none of that will get into my mouth or nose and infect me because I have a covering there. And I get it. The virus is small and can get through, but those droplets don't always get through. So anything you have over your face is going to be better than nothing, where people are essentially, you're just breathing in all the air that they're coughing away. So yeah, once the virus is like actually floating in the air, you're not going to stop that with, a thin little piece of fabric. But those droplets that get projected when someone's coughing, many of those are going to get stopped if you have stuff over your face. So yeah, there was this argument early on that, well, if you're not wearing an N95 mask, you might as well be wearing nothing. It doesn't make sense. It makes sense that there are ways in which the infection could be spread, which any kind of covering could stop. But yes, if the virus is aerosoled, if it's floating in the air, you still can potentially breathe it in if you just have a piece of fabric over your face, but it can stop other stuff. So finally, they're actually recommending that we do this.
We're also taking action to ensure the cost of no barrier to any American seeking testing or treatment of the coronavirus, the largest insurer nationwide, the Blue Cross Blue Shield system, has now announced that it will not require any copays, which is really something. That's a tremendous statement, from patients of the virus. Treatment for the next 60 days, similar to the commitments of Cigna, Humana, Anthem. Those are great companies, and they're all doing the same thing. So copays, for them to do that it's a big statement. We appreciate it. Today, I can so proudly announce that hospitals and healthcare providers treating uninsured coronavirus patients will be reimbursed by the federal government using funds from the economic relief package Congress passed last month.
Finally, it's the people are stepping up and saying whether you're insured or not insured, you're going to be covered for testing of coronavirus related stuff or treatment. So what they're saying is you're not going to go into debt. So there's this idea that we're going to be paying for people to get covered medically. And I think when we leave this, there's going to be some interesting questions the country has been asking itself, which we're going to have a new perspective on. And one of those is healthcare, right? We've been hearing, and some people call it crazy, and some of us think it's a good idea, this idea that you should just be covered, right? You should be covered for healthcare. If you are an American and you are sick and you go to the doctor, you should be covered. You should get treatment, and you should be able to go back home and then pick up your productive life and have your job and do the things you need to do. And then you'll pay taxes to pay for other people when they get sick and they get hurt, like the rest of the civilized world does, where when you get hurt or you get sick or whatever, you get medical coverage. Right? So there's this idea that now it's okay, but it's only okay in a world pandemic. No, maybe it's just okay. Maybe it's okay that when people get sick, they have a right to medical coverage since they're working and they're paying taxes and we all kind of take care of it. And then when you get hurt for some medical reason, it doesn't drastically have to change your whole life because of the financial part. Right? Obviously, certain things that happen to you medically are going to change your life, but the financial part shouldn't be the part that ends you, right? And we can all work together as a society to make that happen. So I hope we continue that conversation when we come out the other end to say, hey, this thing where people who were sick went in and got medical coverage, maybe that's an okay idea. Maybe we can make that work as a country.
I'm also signing a directive invoking the Defense Production Act to prohibit export of scarce health and medical supplies by unscrupulous actors and profiteers. The Secretary of Homeland Security will work with FEMA to prevent the export of N95 respirators, surgical masks, gloves, and other personal protective equipment. We need these items immediately for domestic use. We have to have them.
Okay, so there's been a few stories lately about companies possibly sending masks to other countries because those countries are willing to pay more for them. So I think this falls in that category of another uncomfortable question that our country is going to have to ask ourselves when we get out of this. Because, of course, we fundamentally all understand that that is unacceptable. Why should a company here in the United States be producing things and then sending it to other countries because they're willing to pay more? That sounds disgusting, right? That sounds horrible. But if you think about it, that's the way our country operates, the profit motive. Does this benefit the shareholders? Does this benefit the CEOs and the upper management? Are those ultra-rich people benefiting from these actions? And that's what our country constantly, we judge morality and ethics based on, does it make a profit? And if the answer is it going to make the shareholders richer? Then the answer is yes, you do it. Is it not going to make the shareholders richer? Then you don't do it. Right? That's how we make decisions in this country. And I think that's another question we need to ask ourselves when we come out of this is, well, remember in the coronavirus when we said maybe profit was not more important than people's safety? Maybe we need to remember that. And I'm hoping that our generations that are around right now will remember that lesson and will say, maybe profit is not the only thing to consider when we make business decisions. Right? So it's good that we're clamping down on companies from sending things other places, but maybe we need to extend this and think about how that might work once we try to return to normal. right? Maybe there's something more important than profit.
The Army Corps of Engineers has assessed more than 100 facilities in all 50 states and is rapidly building temporary hospitals.
I know, you hear it every time. I'm blown away by the Army Corps of Engineers and how they go in, they turn these hotels and convention centers and other places into hospitals. It blows me away. It's awesome, and I think it's cool how they're doing that. And they're basically these heroes coming in and saving the day with their smarts, right? How can we convert this hotel into a hospital? And then these really smart people go to work and do it. That's what our country should be doing. Really smart things that are impressive.
And the big news, of course, over the last few days was that the FDA, once again in near record time, has approved an antibody test developed by Celex.
The antibody test is a good it's a big deal, not only for the short term, but for the long term. In the short term, so the antibody test is the one that tells you not if you have coronavirus, it's the one that tells you if you had it. So some people, like the asymptomatic people, basically they never got the full sickness. They had the virus in their body. They were walking around infecting people. And then we have people who got sick, but maybe they thought it was the flu. Maybe they thought it was some other thing. They should be able to go in and test whether you had it or not. So one reason this is a big deal is that the current line of thinking is that you probably have a decent long-term immunity once you've had the coronavirus. So if you've had it and it holds out and it turns out to be true that once you've had it, you're immune to it, you have some lasting immune to it, that would be good to know for each individual. Do I have immunity to the coronavirus or do I not have immunity to the coronavirus? That's obviously a health concern that people need to know. Aside from that, it's one of the ways that they're going to go back and they're going to think about how our country maneuvered around this coronavirus. Should we have moved sooner? One of the big criticisms, you hear it from me a lot, and you're hearing it from the reporters, you're hearing it from a lot of people that think Trump should have moved sooner to act on all of this. He waited around saying it was a hoax, saying it was no big deal. There were a dozen cases and then 5 and then 3 and then they were all just going to be gone. That's what he predicted, that it would all be gone by April. All the stuff would just be like a bad dream. But that didn't happen. It just got worse to the point that we're in, that they're now warning us the coming week is going to be a historic week in the history of our nation. It's going to be bad. Maybe we could have avoided some of those lives. Of course, people were still going to die, but what if we could have had those numbers significantly reduced by acting earlier and maybe not being so concerned about the economy? Of course, the economy is important. Of course, making profits is important. But when we're talking about tens of thousands of lives between, hanging in the balance of when you decide to make a decision, and if we make the decision here, we're going to lose 100,000 versus if we'd done it 2 weeks earlier, maybe we'd only lose 50,000. Who knows? These are the kinds of questions they're going to be able to answer because they can go back and they can test blood samples in the hospitals and using the antibody test, and they're going to get a better idea about how many people were infected earlier. In a previous press conference, when asked, should Trump have acted earlier, they were saying, well, it depends if the virus was here. The indications are that the virus was probably here, probably circulating for weeks before we took action, and if we had taken action earlier, probably we wouldn't be as in a bad a situation as we are. As you can see now, the states who were the last to lock down, some of those states, even though they're not overly populated, are having a pretty bad situation and are expected to have a pretty bad situation the next 2 weeks. So it stands to reason locking down earlier probably would have been a good thing. This antibody test is going to help us answer that kind of a question. So it's important for that reason too.
And Secretary Azar, in a few moments, will explain just how the president's decision to make sure that no American will ever have to worry about paying for testing or for coronavirus treatment.
So he just said it. There's not much way around what he said. He just said every American is not going to have to pay for coronavirus testing or treatment. So I hope that's true. I hope there's not details that come out later that say, well, in these certain situations, I hope that's the case. And it's really going to get us thinking about this situation of, well, yeah, shouldn't that just be the way that it works? That when you're sick, you go get health care, and then you go back to being a person that, you don't lose your job because you got sick, and you can still make a decent wage, and you can still pay taxes that then go to pay for other people who are down on their luck and need medical care. In other words, we're all getting medical care at different times that we need, and we're all paying the taxes to support that, right? It's a good idea. It's a good idea. Seems to work during the coronavirus. Maybe it could work in a normal situation, everyday situation as well.
Getting the uninsured access to the care they need is a top priority for President Trump. We are already rolling out the $1 billion in funding from the Families First Coronavirus Response Act to cover providers' expenses for testing and diagnosing the uninsured. The CARES Act, signed by the President, includes another $100 billion for healthcare providers. Under the President's direction, we will use a portion of that funding to cover providers' costs of delivering COVID-19 care for the uninsured, sending the money to providers through the same mechanism used for testing. As a condition of receiving funds under this program, providers will be forbidden from balance billing the uninsured for the cost of their care. Providers will be reimbursed at Medicare rates.
Okay, so he laid it all out. Whether you're insured, whether you're uninsured, your testing and your coverage for coronavirus should be covered. That's good because, for one thing, it's just the humanitarian thing to do. Also, it keeps us all safe. We don't want certain people out there not getting treated because they don't have coverage, because that person's just going to keep infecting people, right? We also want that person taken care of. We don't want people to die, but also we don't want that person to go infect 20 more people, right? We got to stop this thing, and that requires medical coverage.
Thank you very much. Okay, let's go, Steve.
If we could draw you out a little bit more on the advice on face mask, what would people gain from wearing a mask, and why are you opposed to wearing one yourself?
Well, I just don't want to wear one myself. It's a recommendation. They recommend it. I'm feeling good. I just don't want to be doing, I don't know, somehow sitting in the Oval Office behind that beautiful Resolute desk, the great Resolute desk. I think wearing a face mask as I greet presidents, prime ministers, dictators, kings, queens, I don't know, somehow I don't see it for myself. I just maybe I'll change my mind, but this will pass.
So I'm pretty sure that Trump just said that during the global pandemic, he will be meeting in the Oval Office with, among kings, queens, presidents, and dictators. He just said it. He just said that during this outbreak, he'll be sitting in the Oval Office with dictators. Am I the only one that thinks that's a little bit of an odd statement to make to the American people? He doesn't want to wear a mask because how would that make him feel when he's sitting behind his desk in the Oval Office and in front of him is a dictator? Why would any of these people be coming during the pandemic anyways? But on top of that, he's meeting with dictators. Okay, that's weird.
That we now know from recent studies that a significant portion of individuals with coronavirus lack symptoms. They're what we call asymptomatic. And that even those who eventually become pre-symptomatic, meaning that they will develop symptoms in the future, can transmit the virus to others before they show symptoms. This means that the virus can spread between people interacting in close proximity. For example, coughing, speaking, or sneezing, even if those people were not exhibiting symptoms. In light of this new evidence, CDC recommends and the task force recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain. These include places like grocery stores and pharmacies.
So I've actually been hoping that our country would move towards this for a long time. I think it makes a lot of sense when you'd see in these Asian countries where people are walking around with masks on. But in this country, we think it's really, really weird. When we see someone with a mask on, it's like they're a freak or something. They're doing you a favor. They have a cold or a flu, or as of late, the coronavirus, and they're trying to not spread it to you. We should be thankful for those people. We should be thanking them we should be grateful, not thinking they're some kind of weird freak, right? I like the idea that if you have to go to the store and you have a cold or flu, throw a mask on and you're less likely to spread it to other people. There have been, doctors telling us for a long time, if people would stop shaking hands and they would wear a mask when they're sick, a whole lot less people would get colds and flus each season. And I would prefer less colds and flus. I like that. So I'm kind of hoping we stick with some of this when we go back to normal. I would like to see the handshake done away with. I've never been a big fan of shaking hands myself. Basically just start thinking about how I need to go wash my hands afterwards. There's other things we can do. We can bow, we can wave, we can come up with some whole new system where we, give each other some kind of a sign of respectful greeting, but we don't need to take our grubby hands and rub them together in a big, manly grip. We don't need to do that anymore, right? And I hope we keep these kinds of things up. I hope shaking the hands has gone the way of the dinosaur, and I hope we start wearing masks in public and we don't treat people like freaks when they do it. They're trying to protect you. They're trying to protect me by not making me sick, right? And also, it's now being shown that you're kind of protecting yourself to some extent if you put a mask on. Sure, once the thing is, what do they call it, aerosolized, where it's actually in the vapor, then yeah, you can breathe it in through the fabric. But also, if someone coughs in your direction and they don't cover it, those little droplets have been shown to travel a long distance, and you don't want those in your nose or mouth. So having something over your face will at least stop some of the droplets, right? It's not going to give you total protection, but we seem to have this idea that if it's not giving you total protection, it's giving you zero protection. Well, there's a middle ground, right? And I'll take partial protection over zero protection any day.
Mr. President, Dr. Fauci last night said that every state should have stay-at-home orders right now. Do you agree with that? Should every state in this country have the kind of stay-at-home orders that we now see in places like
I
Washington?
leave it up to the governors. The governors know what they're doing. They've been doing a great job. I guess we're close to 90% anyway.
Yeah, I get from a political standpoint, it's a little tricky between, you've got the 14th Amendment and you've got the federal government exerting too much control over the states. I get that there's an argument or a discussion to be had here, but in my opinion, the President of the United States has a lot of control, and he should be setting what the nation should be doing. Of course, the governors will make their legal decisions for their states, but if the President comes out and says, hey, everyone, why don't you just get on board with social distancing? We'd really appreciate it, which he's kind of done, but if you make it clear we really need every state doing this, then that puts pressure on those states to fall in line. Now, the governors can choose to do what they want, but hopefully that kind of pressure would make them do, or at least added pressure would make them do the right thing by their people. Right now, we have governors making decisions that I don't really trust are for the best interest of the people. A lot of these governors are making decisions about their future political careers. The scientists seem to be making decisions about people's lives. So I'll trust that, right? If I have to make a choice between people's lives or some guy's future career as a politician, I'll take the people's lives every time. So it's kind of a messy issue, but how about if we just listen to science? Why don't we listen to the scientists and what they're saying?
And where is Dr. Fauci?
I don't know, but every time you ask that question, whenever he's not here, you say, where is he? And you'll say, is there a problem? No problem whatsoever. Every time he's not here, sometimes I'll ask him to come because that's the first question that you and a couple of others from the fake news establishment ask is, where's Dr. Fauci? We're doing great together.
So Trump's tantrums seem to be kind of coming back again. He can't answer a question with class and dignity and presidential in manner. He's got to throw a little bit of a tantrum. He's got to throw out fake news. He's got to act like somebody's up to something for asking perfectly legitimate questions. And the American people have a question. That Anthony Fauci is saying things that could be seen as rubbing, Trump the wrong way because he doesn't always agree with Trump. And we know how Trump takes that when people don't agree with him. So it's a reasonable question to want to understand that relationship between Fauci and Trump because we need to know who to trust, right? We need to know is Fauci being reined in, or is he really free to say the kind of things that he want to say? So it's not a gotcha question. It's not, he's throwing this tantrum here. It's about trying to understand who we should be listening to, because our lives are on the line here. Right? Our lives are on the line in this nation and around the world, and we need to be able to make informed decisions about what's best for us.
Mr. President, you have said nobody could have seen this pandemic coming. But in fact, Secretary Azar at a biodefense summit in April 2019 said, of course, the thing that people ask, what keeps you most up at night in the biodefense world? Pandemic flu, of course. I think everyone in this room probably shares that concern. Your own Health and Human Services Secretary was aware that this had the potential of being a very big problem around the world, a pandemic of this nature. Who dropped the ball?
Well, I always knew that pandemics are one of the worst things could happen. There's been nothing like this since probably 1917. That was the big one in Europe. It started actually here and went to Europe, probably. I've heard about, excuse me, wait a minute, let me finish. I've heard about this for a long time, pandemics. You don't want pandemics. And I don't think he was talking about a specific pandemic. He was talking about the threat of a pandemic could happen, and it could happen.
So notice he's not really answering a lot of questions. Yes, so Trump admits he knew a pandemic was a bad thing. Okay, good. That's some valuable knowledge there, that pandemics are not a good thing, they're a bad thing. But the question is when he knew and when they could have done something about it. And Trump says, I knew pandemics were bad, yet we cut the CDC, yet we cut the teams that were supposed to give us a heads up well in advance that we need to be paying attention to these pandemics. We weren't building up our stockpiles. We weren't doing all the things to get ready for a pandemic, but he's going to stand there and say, we knew pandemics were bad. We just didn't prepare for any of it.
But Secretary Azar, if you were preparing for a pandemic, if this government were preparing for a pandemic, why is it we don't have enough masks? Why is it we don't have enough medical equipment in this country?
Previous administrations gave us very little ammunition for the military and very little shelf space. Let me just tell you, you know it. You know the answer. The previous administration, the shelves were empty. The shelves were empty. So what you should do is speak to the people from the previous administration, Jim, and ask them that question, because the shelves were empty. And you know what else? The military shelves were also empty.
Okay, so first of all, that's not actually true in either case. The shelves weren't empty. But let's just say that they were empty, right? Let's just say that the shelves were empty and the stockpiles were all depleted. Trump has been in office for over 3 years at this point, right? When this stuff all started blowing up, he'd been in office for 3 years. That's plenty of time to fill the shelves. So when you're 3 years into your 4-year term, you don't really get to put something like this on the previous administration. You can't blame Obama for this one. This is just a made-up nonsense excuse that doesn't hold any water. Okay, you had 3 years to start saying, yep, there could be a pandemic, and so it's really important that we get the masks and all the kind of equipment and ventilators and all that kind of stuff stored up. You had 3 years to do that. Instead, they spent that time cutting our ability to attack the pandemic, right? Cutting funding for the CDC, pulling back these teams that were in other countries prepared to warn us about things. All that stuff got cut, but he's going to sit there and say, oh, it's Obama's fault, right? Just like everything else is Obama's fault, this is Obama's fault too, even though Trump had 3 years to build up those stockpiles. It doesn't hold water.
Go ahead. We'll get it back. We'll get you back. We'll get you back, please.
What about that question?
Jim, I said we'll get you back. Please, go ahead.
And you can see right there that the reporter is trying to get through to him. Look, what you didn't actually answer the question. You push it off on another administration. We're well into this administration's term where you could have done something about it. The time has passed that you can blame someone else for this.
Thank you. Yesterday, Jared Kushner said the notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be state stockpiles that they then use. What did he mean by our?
Oh, why didn't you ask him?
And
I mean,
even the fact that taxpayers from
what's that?
every
It
state
got you.
pays
I got
for
you.
it.
You
No,
used
it's
the
not
word
a
hour.
gotcha. What did
Hour.
he
You
mean
know what
by
hour means? United States of America. That's what it means. It means
the states.
hour. It means the United States of America. And then we take that hour and we distribute it to the states.
So why
Not that we have
It's
to.
not supposed to be state stockpiles that they then
Because we
use.
need it for the government and we need it for the federal government. But
To
when
give
the
to
states are in, no, to also
Then who are
keep,
you giving it to if it's not to the states?
to keep for our country, because the federal government needs it too, not just the states. But out of that, we oftentimes choose, as an example, we have almost 10,000 ventilators, and we are ready to rock with those ventilators. We're going to bring them to various areas of the country that need them. But when he says our, he's talking about our country.
He makes
He's
a
talking,
distinction.
excuse me,
And sir-
he's talking about the federal government. I mean, it's such a basic, simple question, and you try and make it sound so bad.
It's
You
not
ought to be,
bad. I'm
you ought to
just
be
trying to
ashamed of
understand.
yourself.
No,
You know what? You ought to
by
be
the
ashamed.
way, Secretary
It's such a
Azar-
simple question. He said our, and our means for the country, and our means for the states because the states are a part of the country. Don't make it sound bad. Don't make it sound bad. Go ahead, Steve. Go ahead, back here.
Did you just even change the
You just
language
asked your
on the
question.
website?
You just asked your question in a very nasty tone.
It was nasty.
Let's go.
You didn't give me an answer.
Please.
Mr. President,
I gave you a perfect answer. You know it. Go ahead.
Okay, so here we have another example of Trump throwing a tantrum and in no way acting presidential. So the question that she asked was a very legitimate question. The country is asking themselves this question. We were all very confused when Jared Kushner came out and said, these are federal stockpiles. They're not for the states. And I'm paraphrasing, but essentially he said they're not for the states, shouldn't be thinking of them as resources for them to use. This is the federal stockpile, and she's answering this question. And you know what? Good job on her for maintaining what I would say is an ultimate level of professionalism, where one of the most powerful people in the world is attacking you in a very childish way, throwing his tantrum up there, and she remained cool and perfectly online. Good for her. That could rattle a lot of people, but she stuck with it. And Trump is just jumping around in his answer. It doesn't make any sense at all. He's saying, no, by our, we meant the states that make up the country. But Jared Kushner specifically said it's not for the states. And so then she pushes back and Trump says, well, it's for the federal government, which to a small percentage, a tiny slice of the pie there, of those stockpiles, yeah, that's probably a legitimate reason for a tiny slice there. The employees working for the federal government, trying to keep our federal government working, I'm sure there are numerous positions where those people should have masks and protective suits so they can go through and do their job and not get infected with the virus. That sounds totally legitimate. However, that's not the entire stockpile. You can't say the entire stockpile's for federal employees. There aren't enough federal employees in position to need all that kind of stuff. The whole purpose of these is for the states. That's the point of these massive stockpiles, is to be able to give them out when they need to be given out. So her question stands because he never answered it in any kind of substantive or genuine way. He was just jumping around trying to say anything that was going to throw the attention off of him, and he starts throwing a tantrum how she got a perfect answer and she knows it, and she's asking a nasty question. It's not a nasty question. It's a question that many of us in this country would like a legitimate answer to. What was he talking about when he said these are not the state's stockpiles, that they're our stockpiles? What is Jared Kushner? Who does he think he is? That it's his stockpile somehow? It doesn't make any sense at all. And this is a perfect example. I mean, if you just came out of nowhere and you had no idea who Trump was, if you just woke up from a coma and you watch this, it would give you a pretty good idea of what the Trump presidency stands for. It doesn't really stand for anything, just a bunch of nonsense where they break the rules and they say things that don't make sense, and then they just kind of ramble their way out of them and ignore reporters when the reporters try to ask legitimate questions about it. That interaction right there is a large part of what the Trump presidency is all about.
Because I know we're always saying who knew what when. I just want to make clear, there's 150 plus countries working on this collectively together. It's devastating for every single country. When we get through this, we can go back and look at what happened, where, and what does this epidemic look like. And when you get through it, then you can validate every model there is known to man. When you're in the middle of it, you have to concentrate on serving the needs of each American and what that need looks like. At the same time, you have these other work streams on surveillance and how to be prepared both scientifically and therapeutically and vaccine-wise for the next fall if that happens again. So I think these things are happening together, but I just want us to really concentrate on the fact that all around the globe, country after country is dealing with this. And we can talk about why didn't Italy do something, or Spain do something, or Germany do something, or we can really say right now, we all can do something. We can do the social distancing and all of the pieces that we know is starting to work around the globe in country after country. And then when we get through all of this, we can ask the questions about, could we have done some piece of this better as a global community? I will remind you that on February 3rd, the head of the WHO said there was no reason to ever do a travel ban. You know, it wasn't until January 14th that we knew that there was human-to-human transmission.
Dr. Burke, the president was saying this was going to go away. It's April.
It is going to go away.
Mr. President,
It
you
is going
said
to
it
go
was going to go away in April. You said when it warmed up in April.
I said it's going away, and it is going away. Okay.
Yes.
But
Okay, that was a good answer to your question. No more. That was a long but a very good answer. That was enough for you.
So Trump didn't like that question, and he cut it off immediately. Now, Dr. Birx, I'm sure she knows her stuff, and she's very knowledgeable about diseases and viruses and stuff, but she definitely seems to provide Trump a lot of cover. And her answer in this situation wasn't really related to her expertise on pandemics. It was really about a more political question. It was almost like a motherly question where it's like, okay, let's stop asking hard questions. Let's stop beating up on each other and being mean. We can do all that later after this is all done. Right now, we need to focus on the problem. Well, these reporters are here to focus on the current issue and what was done in the past and what's been done going forward. These reporters aren't going to go out and fix the virus issue. They're reporting on what's happening now. And I think it's an important question because, as we've seen, if Trump doesn't get his feet held to the flame, he just does whatever he wants. The only thing keeping him from running completely rampant is the fact that he has to answer occasionally to a press that says, hey, what about this? Can you answer this hard question? Why weren't we doing things sooner? Why did we wait so long? And, you know, Birx can sit there and say, well, we can ask all those questions months and years from now. Now's not really the time, but now is the time. Because if nobody is checking this president, he's just going to do whatever is going to make him money, whatever is convenient for him and his friends. That's what he's going to do. And so these questions need to be asked now, because on a day-by-day basis, things are going to spin out of control if there aren't people asking him hard questions. And that's why he didn't want any of it. Just nope, we're moving on. He said, you got too much time. You got a great answer to your question. And he didn't get either. It took a long time for, Birx talked a lot, but no real answer was given. There's nothing of substance in that kind of an answer. So more than anything, we need these reporters in there asking questions that make Trump struggle, because that's the only thing keeping him from making, completely going off the rails here at this point.
Mr. President, on the insurance coverage for treatment, when your government is trying to make sure that people are covered on the treatment,
we're going to do
that. Does that include the 11 million people who are in this country illegally? Are they going to be covered as well?
We'll be talking about that at a different time. Yeah.
And he wanted nothing to do with that question either. So I don't know. I'm not sure what is in his mind when he's doing this, what kind of balancing act he's trying to pull. So I don't know if it's that they don't know, they haven't considered this. They talked earlier, they kept saying Americans are covered, but they didn't say anything about people who are here undocumented. So maybe he hasn't even thought of that answer, or maybe he's afraid that it's going to hurt his base, the people that just are so anti-immigrant, anyone who's not supposed to be in this country getting any kind of a benefit from the government. He may feel like that could hurt his support from his base. That would be seen as kind of a liberal idea that all of a sudden there's undocumented workers here and we're giving them health coverage. Although, let's face it, every person that gets treated for coronavirus is someone who's not going to continue to go out and spread that virus to other people. The virus doesn't check your documents to see if you're supposed to be here or not. It just infects people. So really, we need to get the virus under control and not really worry too much about who's documented and who's not. We need to get the infection under control.
Please, go ahead.
Thank you, Mr. President. This is for you and Secretary Azar. 10 million people say they've lost their jobs in the past 2 weeks. So how is this stimulus money for free treatment going to absorb the new numbers of uninsured? And would it not be easier to reopen the Obamacare markets or expand Medicaid?
So for an individual who had employer insurance, that's what I mentioned in my remarks, if you were employed and had insurance through your employer and you've now lost your job and lost that insurance, you now do have a special enrollment period where you may enroll in the individual exchanges of the Affordable Care Act. So that's existing law. Then what we're doing is taking from that $100 billion to providers, taking money and saying, if you're a provider and you care for anybody who's uninsured, we're going to compensate you for doing that. And we're going to compensate you at the Medicare reimbursement rates, and you are not allowed to bill that uninsured individual anything. So in many respects, it's better for those uninsured individuals. They're going to get first dollar coverage, they're going to get care in the United States, and the provider is going to be made whole from this program. So it's really an unprecedented, what President Trump is doing here with this money is an unprecedented disease-specific support of care for individuals to make sure that people get treatment.
So it's interesting. All the credit is going to Trump for the fact that they're now giving Medicare to everyone, which is interesting, right? This idea is kind of catching on. We'll see if it lasts when we come out the other end of this to realize, oh, it's actually a good thing when people can get health coverage when they need it. But they claim that's where we're at, which is that whether the people who lost their jobs, whether they were insured or not insured, are going to be able to be covered one way or another. People are asking, well, why don't we open the Obamacare again? Well, he's saying it's already written into the law that if you have an employer who's giving you medical coverage and you lose that job, you can sign up under Obamacare. That's current law. That's not new. And then he's saying in the case of people who can't get that kind of a coverage, we still will take care of you. I hope that's true. I hope that's how it works out.
I assume I don't have the virus, so I don't have to worry about spreading it. Okay?
Okay, so that was our president just saying, I assume I don't have the virus, so I don't have to worry about spreading it. We keep hearing all these experts saying day by day it's becoming more and more clear that people are walking around for days not even having any clue that they have a sickness or the virus, and they're spreading it to other people. He clearly, his head is in the clouds. He has no idea what's going on. I'm not sure if he knows where he is. He's just not listening to the stuff that he's in the room that they've been explaining numerous times. You can be walking around and not know that you have it. And so he probably doesn't have it, but how many people are in that room walking around with him, spreading it to him? I mean, Boris Johnson is now in intensive care over there. I mean, it can reach these leaders, and he just doesn't get it.
Two questions on continuity of government.
How come you always have two? Why can't you have one?
Well, they're related.
Every time. I have three questions. I have two questions. Can you give me one instead? Because you have a couple of other people. Go ahead.
Okay, I'll go with my second one. The governor of Wisconsin is now talking about delaying the primary, or at least not having in-person voting. So my question is, and I asked this a couple weeks ago, I want to see if you've made any progress on this. Looking ahead to the fall, are you taking steps to ensure that the general election will happen even if this pandemic has reemerged or hasn't gone away?
The general election will happen on November 3rd. In Wisconsin, what happened is I, through social media, put out a very strong endorsement of a Republican conservative judge who's an excellent, brilliant judge. He's a justice. And I hear what happened is his poll numbers went through the roof. And because of that, I think they delayed the election.
Concerned about people going to in-person voting?
I don't know. Why didn't he do it before? He's doing it right before the election.
But do you think
Excuse me. Why did he do this 2 weeks ago? All of a sudden, all of a sudden an election which is taking place very soon gets delayed. Now, I just endorsed him today, and it was a very strong endorsement. His polls, he's gone very high up, and all of a sudden the governor comes out, the Democrat governor, by the way, comes out and says, oh, we're going to move this election. So I don't know. I hope you're right. I hope you're
But do
right.
you think every state in this country should be prepared for mail-in voting?
No,
in case we're in a
because I think a
situation?
lot of people cheat with mail-in voting. I think people should vote with ID, voter ID. I think voter ID is very important. And the reason they don't want voter ID is because they intend to cheat. When you get something, when you buy something, you look at your cards and credit cards and different cards. You have your picture on many of them, not all of them, but on many of them. You should have a picture on your for voting. It should be called voter ID. They should have that. And it shouldn't be mail-in, excuse me, it shouldn't be mail-in voting. It should be you go to a booth and you proudly display yourself. You don't send it in the mail where people pick up all sorts of bad things can happen by the time they sign that, if they sign that, by the time it gets in and is tabulated. No, it shouldn't be mailed in. You should vote at the booth and you should have voter ID. Because when you have voter ID, that's the real deal. Thank you very much. We'll see you tomorrow. Thank you.
So here we go. We're already getting ready for this. There's been some talk about it. It's pretty well established. When very few people vote, the Republicans do well. When lots and lots of people vote, the Democrats do well. So the Republicans are trying to do whatever they can to make sure that elections are happening where very few people are going to vote. That's the whole idea here. It's why they don't want mail-in ballots. It's very disappointing that we live in a country where literally there are people trying to keep people from voting, right? And this is happening in all sorts of ways. And it's because the Republicans know they win when the vote is suppressed. When less people vote, the Republicans end up doing well. And so that's one of the reasons our democracy is actually under attack, because there are numerous ways. It's not even like there's just one. There has already been, for the past few years, numerous attacks on trying to keep people from voting. And now they're taking advantage of the virus to say, hey, this is another way we can make sure that we have very low voter turnout. Because as we've seen, right, if you look at the demographics, Republicans and older Republicans, people who vote, they're willing to go out. They're not real scared about this virus. They'll go out. They were eating in restaurants and posting videos about, hey, look at me. I'm supposed to be home, but I'm eating in this restaurant. And you know, showing their Republican pride. And this is what's going to happen on Election Day. People are not going to go out because they're scared of the virus, or because maybe they're not so excited about the Democrat that they're, you know, maybe they would have voted for the Democrat, but they're not willing to go risk their lives or end up bringing the virus home to their families. And voter turnout is probably going to be quite low. And that's just going to make sure that we have Trump back in office again, along with a whole slew of other Republicans following him in other positions of government. So that's why you're seeing that. The last thing the Republicans want is a high voter turnout. It doesn't work out in their favor. Okay, so that was another chilling, sometimes disturbing, unsettling look at Trump and his state of mind and what he's thinking about the virus and how our country is running right now. So make sure you hit subscribe so you can check out all the new content as it comes out on Political Perspective.